Good morning, everybody. Obviously, our thoughts are with everybody who's been impacted by that earthquake in Victoria, and we know that people in New South Wales have even felt the tremors. So our thoughts are with everybody, and we hope everybody stays safe and accounted for during this very difficult time. Pleasingly, in New South Wales, we've reached 83% of our first dose vaccinations, which is outstanding, and that figure keeps going up. And in relation to our double dose vaccination rate, we're up to 54.2%. More than 9 million jabs have now been given in New South Wales, and I couldn't feel prouder of the way in which the community has responded. Now, in terms of 12 to 15-year-old children, as we know, they were recently invited to come and get vaccinated. Pleasingly, a quarter of that age cohort, so 25% of 12 to 15-year-olds have already received the vaccine in New South Wales. An outstanding result, given school isn't commencing till the 25th of October, so it demonstrates how keen families are to make sure everybody is staying safe. To 8 p.m. last night, we had 1,035 cases of community transmission, and regrettably 5 people lost their lives. And again, we extend our deepest condolences and sympathies to the family and loved ones of those 5 individuals, which Dr. Chant will provide greater detail on. The New South Wales Government is well on the way to producing additional work as we inch towards a 70% double dose and 80% double dose vaccination to get all of us ready for what it means when we hit those targets. And today I'm pleased to have Minister Dominello with me. Minister Dominello, as you know, is the Minister in charge of our Customer Service Division and Service New South Wales, and he is busily working with the Commonwealth to get access to the data which will allow New South Wales to have our vaccine passport through the New South Wales or Service New South Wales app. And Minister Dominello will discuss where we're up to with that, so that when we hit that 70% double dose, irrespective of when it is, we're ready to roll out that vaccine passport. I wanted to again assure our business community that the New South Wales Government will have a similar compliance regime to before the Delta outbreak. We'll make very clear what responsibilities individuals and businesses have in making sure everybody complies to the rules. It won't be very different to what happened beforehand, but of course, as we get closer to that time, we'll remind everybody what the expectations are of business, government and individuals working together to ensure that's the case. The New South Wales Government is also busily working on our 80% roadmap. So we've obviously put out our 70% double dose roadmap, which we expect will start implementing very excitingly somewhere in the middle of October. And we'll know obviously closer to that time. And then obviously the next step after that is what does life look like at 80% double dose vaccination? And if it's up to Dr. Kerry Chant and I, we'd like to see at least 90-something% of our community adult 16 and over have at least 90-something% first dose by the time we get to that. And in all likelihood, we are looking towards seeing those healthy figures. I again want to thank the people of New South Wales for being so patient. There's not long to go now. It's been a hard slog. But I think all of us can see the light, and all of us can't give up and get too complacent at the last hurdle. We have to stay with the program for the next few weeks, make sure that we follow all the rules, that we get ourselves vaccinated, and what we're looking at in particular is to make sure where there are pockets of communities that for whatever reason have low vaccination rates, that we try and target those communities depending on the supply we have of the vaccine, but also making sure that everybody has access to the vaccine before we open up. Dr. Chant will now give the health update, and Minister Dominello will talk about the news around the vaccine passport and other Service New South Wales developments. Thank you.
There have been 1,035 locally acquired cases of COVID reported in New South Wales to the 24 hours to 8 p.m. last night, and no overseas acquired cases. Again, testing levels were very high at 133,839. So thank you to the community for continuing to present for testing. In terms of COVID cases, we currently have 242 cases in ICU, and they range across all age groups, again highlighting that COVID can be a severe disease across the age spectrum. In terms of sewage detections, we've had a very high sewage detection from Oberon in Western New South Wales. Please come forward and get tested if you have the most minimum of symptoms. We need a high rate of testing to assure ourselves we're not missing undiagnosed cases in those communities, and please be very cautious. I also want to highlight that we are seeing increasing cases in the Illawarra area, in Wollongong, Shell Harbour, Kiama. So again, a call out to get tested, but also please come forward and get vaccinated. Sadly, we've been notified of 5 deaths, and I extend my condolences to their loved ones. A woman in her 50s from Western Sydney died at home. Her infection was diagnosed following her death, and that will be that is under the coronial jurisdiction, and the cause of death will be ascertained in due course. A woman in her 60s from southwestern Sydney died at Liverpool Hospital, and she was not vaccinated and had some underlying health conditions. A woman in her 80s from Wollongong area died at Wollongong Hospital. She had received 2 doses of the COVID vaccine but had underlying health conditions. A man in his 70s from Kiama died at Wollongong Hospital, and he had received 1 dose of the COVID vaccine and had underlying health conditions. And a woman in her 50s from southwestern Sydney died at Royal Prince Alfred Hospital. She was not vaccinated and had underlying health conditions. There have been, tragically, 260 COVID deaths related to this current outbreak since 16th of June 2021. In terms of additional cases regionally, there have been no new cases reported in northern New South Wales. As you know, we reported a previous case that had a number of exposures in Kingscliff and Byron Bay, and I can confirm that that individual was doubly vaccinated, and there was 1 new case reported in Mid-North Coast. I'll leave that there and then answer any questions. Thank you.
Good morning, everyone. I just want to give people an update in relation to the integration of the vaccine certificate into the Service New South Wales app. Right now, people can already download their vaccine certificate from their Medicare Express app. So that's available right now. And once you've done that, so download the Medicare Express app, and then you can get your certificate on that app. Another way to do it is, once you're in that app, you can then download it into your Google Wallet or your Apple Wallet. Another way to get it is you can call Services Australia, which is a federal organisation, and you call them up, and if you don't have a smartphone, they will copy the certificate and post it out to you. So already that certificate is available. What we will be doing is integrating that and providing people with the option of then having it in their service app to make it really easy when they're checking into venues across New South Wales. That way you don't have to open up several different apps just to get into a venue. You open up one app, your Service New South Wales app. On that app, it'll enable you to check in, and at the same time on that same screen, it will show your vaccination status. Now, where we're up to so far is we're getting the information from the federal government. Obviously, that's information is through the Australian Immunisation Register. That pipeline is then securely created to Service New South Wales, and provided you consent, your authority, your controls, because it's your data, provided you give that authority, then that will go into the Service New South Wales app, and then you're way to go. We're now in the process of consulting industry in relation to the design of how it should work, and we're pretty much there, and I'll show some screenshots later on. But ultimately, we're aiming to do a pilot in the regions commencing on 6 October for 2 weeks. And then hopefully the subject of that pilot will be strong, and as a result of that, we can then open up to the rest of the state. This is in many ways about future-proofing for the people of New South Wales, because even though we may be ahead of the other states may require vaccination status to be displayed. So, you know, if we get this right, it will enable freedom of movement right across Australia as well in the months ahead. Thank you very much.
If we don't start our 2-week pilot until the 6th of October, this won't be ready in time for when we reach 70%. We're due to reach it on the 9th.
Yeah, it's a good problem to have. If we, geez, I can't wait to open up. But the reality is, right now, there are other options of showing your vaccination status. So this is just to make it easier for people.
Right. So we're still going to open up.
We're absolutely at the 70% mark.
Have you chosen a location for that regional trial? Will there be one in Sydney and one regionally?
No,
one regionally, and where will it be?
We haven't decided yet on the regionals, but it will be regional. We've decided against Sydney because we don't want to create the honeypot effect. because if you create one location in Sydney, then everybody will be drawn to it, whereas in the regions they're already quasi-opened up anyway.
And is it just one
And there's no material advantage in the regions anyway.
just one regional LGA or multiple?
No, there'll be a number of locations that we're exploring.
And what's the criteria in selecting those locations?
Oh, well, we're looking at industries such as clubs, aged care facilities. It's going to be a closed pilot for between 100 and 500 people. So it's not going to be a huge pilot, but it'll be by invitation. So, for example, it'll go to a club and then they can invite certain members if they want to participate in the pilot.
Have businesses expressed any concern to you about the uncertainty or the difficulty in checking different forms of vaccination status? Because as you pointed out, we'll be able to use the digital certificate for Medicare or this app or a printout. Have you spoken to businesses about how they're going to check that?
Oh, we've spoken to industry and overwhelmingly they want this in the service app because it makes it simple for them. It's a great experience for businesses and a great experience for customers. So we're moving heaven and earth to get that ready.
The customers will still be able to use their Medicare certificate.
Yeah, absolutely. And that's why really today is a call to action to get onto your Medicare Express app and download it into your Google Wallet, or if you don't have a smartphone, to get a printed version of it.
What are some of the sort of added security measures that you are building into the app? People have obvious concerns about this, and there have already been reports about from people online saying how easy these are to forge.
Yeah, so there's a couple of security features we'll be building in. One is having a hologram on the face of the app, and that exists on the digital driver's license. So when you move your digital driver's license around, there's a digital hologram. Another one is a feature that we'll be implementing towards the middle of October will be another QR code. So these are additional features. But look, sorry?
What's the new QR code?
To validate that it's a legitimate service product as opposed to a forgery.
So, well, business, yeah, use that.
Right, so that if, for example, depending on the setting you want to go to, I can show you on the phone, but you can go there and say, screen that, and instead of saying, yes, I've checked in, it will say, this is an authentic Service New South Wales.
So the customer signs in, shows check-in, and then the business scans the QR code on the customer's phone.
Yeah, and that will validate that this is a Service New South Wales product as opposed to a fraud.
Two process,
So 2 QR codes.
2 QR codes.
No,
One for checking, one for the-
No, there will be one on the. We're still designing this out now, so I don't want to bet it down yet because we haven't finished the design. But the QR code is there as an additional security feature in the event that people need to check it.
Minister, can I ask you on JobSaver, if the lockdown hasn't lifted yet, can you explain why businesses are receiving payments are now required to confirm their eligibility every fortnight, and why there was no consultation or warning before this change was made?
Oh, look, I acknowledge that in the past, and I apologise for that, but these were policy settings that were changed, and we reached out to businesses at the time, and we accept that. But at the moment, we processed something in the order of 400,000 applications. Over $5.4 billion of money has gone out the door. 90% of applications approved.
But why change the rules halfway through? Accountants say the workload is immense.
Well, it was, but we also have to make sure we get the balance right in terms of probity. So we don't want to. It's a lot of money. This is taxpayer money, and we want to make sure that we get it right to ensure that it's going to businesses that are showing demonstrable loss.
Did you have reason to believe there were businesses that were perhaps rorting that or not being fully honest about their losses?
Oh, we're guided by Treasury in terms of what risk settings they want to apply, and we just implement it through service. But obviously we have to get the balance right. It's not a black and white thing, these settings, and we were moving at a time of extreme urgency. But like everything, you always improve along the way. Nothing should be set and forget in this age.
Yes. Are you aware of the reports that tradies at construction sites are using a fake but identical looking checking page so they can avoid their contact details being used if there's a positive case? Considering we're going to 100% capacity at construction sites for next week, are you confident that this can be stamped out in time?
Yeah, that is very disturbing. I heard about that, and Service found out about that and reported it to the police last week. People should be aware that this is not just a minor offence. This is a serious criminal offence, because you're putting not just your life in danger, but the danger of other lives at risk. And therefore, I would have thought if you're going to set up a fake account and moreover use a fake account, if you get caught, I would expect some serious jail time there, because this is not a minor misdemeanor. This is a serious criminal offence.
So what's the government going to do to try and stamp it out?
Oh, well, that's what I mean. We are building additional features that I'll speak to more of in the next 2 or 3 weeks as we finalise the design around security. But look, ultimately, if people want to do the wrong thing, there will always be criminals that will try to do the wrong thing, and that's why you've got laws to say 6 months jail or $10,000 fines. But I can't stress enough how serious that criminal offence is.
Minister, just on that, this new QR code checks the validity of the Service New South Wales checking, right? If a business is required to restrict access to the venue to only people fully vaccinated who are checking in, won't business need to validate everyone checks in to make sure that they've got a valid Service New South Wales certificate?
Now, the framework will be basically the same as what we've done with the QR code. So the responsibility must rest on the individual, because venues, businesses have done it really tough. We can't expect them to be law enforcement agencies as well. But businesses will need to take reasonable steps. They just can't turn a blind eye. And if you're a corner shop, then obviously you're going to have less resources than a big outfit. So that's the framework that we look at. But equally, if the individual wants to do the wrong thing by deliberately going to a false account, we know people know where to get the legitimate product from, and equally, if people want to do the wrong thing, if they get found out, as I said, there could be jail time there.
Sorry, Alex, I didn't hear the question.
As you approach the 80% roadmap and the release of that, how firm are you becoming on the unvaccinated not being able to?
Oh, look, can I make it very, very clear that the 80% roadmap will also focus on those who are fully vaccinated, and the government is considering when those that are unvaccinated will be able to rejoin those activities. So if you read the Doherty plan, if you read all the risks that all the mitigants we've put in place to keep everybody safe, at 80%, the additional freedoms will be for people who are fully vaccinated, and the government will let everybody know the date or the time frame where health advice says to us it's safe for others to participate in events. But I also want to make this point clear, which I've made for a number of weeks now. There could be major events or other indoor settings whereby the organisers of an event will stipulate that they only want vaccinated people attending. There may be airlines that say we only want vaccinated people coming to fly with us. So whilst the government will obviously have our plans at 70%, 80%, and then another date after that by which the unvaccinated may be able to participate in events or participate in activity, there may be organisations, there may be events which preclude people who aren't vaccinated from attending. And that's, again, a matter for people, of a choice issue. By that stage, every single person in the state would have been offered a vaccination or a vaccine, and it will be up to people's choices by that stage whether or not they choose to be vaccinated. And
in terms of the unvaccinated accessing public clubs and things like that, you're not set on whether that's going to be a vaccination target, which is 85,
no.
or a date.
No, it could be, it's in all likelihood to be a period of time after we get to 80% double dose vaccination. And that's because we don't want to have additional pressure on our hospital system. As I've said many occasions, as you all know, October is likely to be the month where we do see a spike in the number of people, unfortunately, that not only have to be hospitalised, but have to be hospitalised in our intensive care units. We also know it will be an absolute fact that once we start opening up, even at 70%, we are going to see an increase in case numbers. And that means at that stage there'll still be a significant number of the population, adult population, that aren't vaccinated, which is a threat and a risk. And at 80%, when we have additional freedoms for people who are vaccinated, it won't mean unvaccinated people can participate. We will have a date or a period of time which will obviously communicate to the public once we have that health advice and once we've gone through the planning at 80%.
When will we expect to see a plan in terms of how this will be policed and also what the penalties will be for people who are unvaccinated or for businesses to give them an idea?
Yeah. We're obviously working through those compliance issues, and we'll have something more formal to say in a very short period of time. But I don't want businesses to worry. The situation won't be very different to what we had before the Delta outbreak. We had a very good system where people took personal responsibility to check in. Businesses also took on that responsibility, especially if they were larger businesses with thousands of people attending an event, or even larger hospitality venues. But obviously the smaller venues like a coffee shop or a cafe would be more limited in what they can do. So it's not very different to what we experienced before the Delta outbreak, but Minister Dominello's team and the Treasurer and others, as we are working through the logistics of the vaccine passport, obviously those issues will also be considered. But I don't want businesses to think it's going to be a very different system to what we had before the Delta outbreak. It will be very similar, except this time we'll be more cautious about making sure nobody who's unvaccinated is attending those venues until a period of time which the government, based on the health advice, will determine.
Last week you need to seek legal advice for some of those issues, and I mean, I guess in some ways the settings are quite different because people need to be vaccinated. It's very different to last year. You were seeking legal advice. Have you done that, and what's the state?
Oh, look, there's a lot of issues that have to be gone through in terms of work health and safety and other procedures, and these are issues which National Cabinet is dealing with. These are issues which every single state will have to deal with. And I know that private organisations are also seeking their own advice as to what they can and can't do. Many organisations have already said, we don't want any of our workers coming into the premises unless they're vaccinated. We don't want clients to come into the premises unless they're vaccinated. So many non-government organisations, private organisations are already making those decisions. But I'm very confident moving forward that none of us will get bogged down in those legal issues. What is really important is to focus on what the majority will do. The majority of our people are vaccinated, the majority of our people are doing the right thing, and that's what we need to focus on. But I don't want anyone to feel concerned that there's going to be too much red tape or too much of a burden when we reopen. Quite the contrary. Minister Dominello, we're immodest when we say this, but New South Wales is the most advanced state in terms of using technology to support our citizens. We are the most advanced state in terms of what the Service New South Wales app can do, and we look forward to using that technology. The only thing we're limited by at the moment is time. So obviously all the vaccine data is collected by the federal government, and then they present that data to us, and then obviously we have to incorporate that into the app which Minister Dominello described. And I just want to stress again that once we hit the 70% double dose, we'll open up the following Monday. So if it happens to be midweek, say we land there on a Wednesday, it's the following Monday that will open up. We've been very clear about that, just to give everybody a couple of days' notice. Obviously, our real-time information every day lets everybody focus on what exact percentage we're up to, and you can actually work out what percentage roughly we're going up by every day. But in terms of when we physically start opening up, it will be the Monday after we hit that 70% double dose rate. Look, I don't want to speculate, but all I can say to people is please hang firm. We've been doing it tough, and Dr. Chan and I will be very pleased that when we do hit that 70% double dose that our case numbers are lower than what they are now, because we know they're going to go up. We know that people are going to be exposed, and so the better we can do until we get to that date, the better we'll all feel, and that's what our ambition is at this stage. And touch wood, so far the strategy in New South Wales has been working. It's been really hard. And I know that it's been a struggle to keep everybody on the journey and explain to them what's happening at every step. But we've been very clear on the plan, very clear on the roadmap, very clear on what needs to happen. And I just ask everybody for that little extra bit of patience. We're nearly there, and I don't want people getting complacent or thinking they can cut corners, because we know, unfortunately, with Delta, cases spike all the time. And always in midweek, I predict tomorrow's numbers will be higher than today. There's a pattern. They go, obviously the weekend is lower, and it takes about 2 days for the numbers to come through, and then it's higher towards the end of the week, and normally Saturdays have the worst numbers, and then we come back down. So we go through this cycle every week, but every week in the last couple we've seen a decline, and we certainly want that trend to continue. But we also know how volatile the situation is, and we just have to stick with the program for a couple more weeks.
Fire and lockdown. Locals are furious about how a reality TV worker was classified as essential, and Catherine Cusack is calling for Brad Hazzard to resign, saying he's not protecting the regions well enough. Do you think she has right to be angry?
Well, firstly, that person did the wrong thing, and I've been advised by police that that person's been charged. So they were there only to work, but what they did is breach the health orders and went to multiple venues they weren't allowed to go to, and police advised me this morning that person's being charged. So that person did the wrong thing. The system worked. It was people doing the wrong thing, and I'm really glad the police have charged them.
They're sitting ducks up there when we hit 70% and Sydney goes for its holiday. That they don't have vaccination rates anywhere near what they...
Well, I'm urging, I don't know how many times we've asked people to come forward and get vaccinated. Well, every other community, there are opportunities for people to get vaccinated, and we're urging people to do so. And you can't pretend. There are unfortunately pockets of resistance, not many. We're lucky. I'm predicting we'll get very high rates of vaccination across the state. But what we're doing now is having a specific strategy whereby we're literally going through town by town, region by region, suburb by suburb, to pick up why some areas have lower rates than others and to see what we can do proactively to get those rates up.
What's your specific strategy to get those rates up in Byron Bay, Mullumbimby, those kinds of things?
Well, obviously, as I said, there aren't many of them, but there are some pockets of resistance. And the biggest incentive that I think people have is the opportunity to do things we've missed for a long time. And even if you don't happen to care about the safety and well-being of those around you, because we know vaccination protects your loved ones, and even if you don't care too much about the community, I think many people are looking forward to doing all those things we haven't been doing for a while, and that's a really big incentive. But as we know, there'll always be pockets of resistance, but what we're trying to do in the next little while is make sure we identify those communities that legitimately, for whatever reason, have lower vaccination rates. It might be access issues, it might be other challenges, and as you can appreciate, we've done incredibly well as a state, given the bumpiness of the lumpiness of the supply that we've received, and we're grateful for everything. Don't get me wrong, we're grateful for every single dose that the federal government has given us, but it's been a challenge for us making sure it gets to the right places, because the vaccines go directly to the GPs, they go directly to the pharmacists, and they come to us as well. And we've just made sure that we've made sure the vaccine is available everywhere. I know in some regional communities, some regional communities are seeing vaccination rates slightly behind the state average, and we're making sure that we increase those as quickly as we can. Huh? Oh, sorry. Oh, she's done that lots of times before. It's okay. No, look, everyone's entitled to their opinion. I don't agree with it. I strongly disagree with it.
Dr. Chan, if I could ask you a question about Byron Bay as well. This person was fully vaccinated, and as you say today, there's no other cases. Can you help us understand why there was enough risk there with the person being fully vaccinated that it was enough to shut down an entire region?
So, as you know, the vaccines, this person's second dose was just probably on the relatively recent, so may not have had the opportunity to take full effect, but the person was doubly vaccinated. I think it's important to say that people that we can get breakthrough infections in people that are double vaccinated, and I don't think we've ever said vaccines are totally protective, but we know they're so good at protecting against hospitalisation and death, and also reduce your chances of passing it on. I think in this setting, such as the types of exposure venues that this individual had been to, the duration of time, they are high risk, and we know that community has got low vaccination coverage, and we know that those venues that that person went to were more high risk for transmission. So look, we want to take a precautionary role approach in rural areas, and I think you've seen that. I've called out Oberon today because of the sewage. We really want to keep the numbers low, whilst we know that the vaccination coverage in some of our regional communities needs to be brought up. And I think what we've also learnt from Delta is that we need to make sure that there is very uniform coverage, and that we've had the opportunity to reach our most vulnerable. And that's and otherwise we will see these outbreaks and rapid increases in cases. And so at the moment, whilst we're allowing the time for those regions to get those vaccine coverage up, but very even coverage as well across all population groups in those, we are taking a precautionary approach to rural lockdowns.
On Byron Bay, sorry, I just want to ask, on Byron Bay and those kinds of areas, or Byron Bay, Do you have anything specific that Health is doing to increase vaccination rates in fire and farm duty, etc.? Or are you just calling on them to come forward and acknowledging that we might not get the high vaccination rates in that area?
Look, there are a lot of policy settings which will promote people to be vaccinated. As the Premier has indicated, the 70% roadmap is contingent on only vaccinated workers as well as vaccinated patrons. And so that's a key incentive. We've also mandated vaccination in very particular circumstances where the risks are high, for instance in aged care and healthcare settings. But we also want to know that part of this is that the community in Byron probably falls into a number of camps, ones that need to be supported with more information. I mean, it's reasonable that people have the opportunity to ask their questions, to have them answered, to go through the science. I'm very convinced by the science, but we do need the opportunity to engage. So we do have a lot of social products which address people's concerns. There's a lot of misinformation on social media, and I just would urge the communities to really go to those reputable sources. Our websites, the Commonwealth Government websites, but also things like the National Centre for Immunisation Research, Children's Hospital websites. All of those websites will give you accurate information that hopefully addresses your concerns. And obviously I'm confident that if we support the community, that the vast majority of the community will embrace the benefits of vaccination. I mean, in the end, this is such an essential part if we are going to live with COVID. And I think we've also seen the fact that when communities experience the disease in their communities, it does also bring it into sharper focus. So I think that as this gives them a sense that they haven't had much exposure, and this gives them the warning that no one can be complacent. And I read out the deaths every day. I read out the ICUs across, and I think, you know, it's going to take a process, but I really want to talk to those communities where immunisation is low.
Forced into quarantine. Was that the reason for the local lockdown there and obviously in the vulnerable Indigenous community?
Look, obviously we're very cautious about giving out a lot of the specifics of every case, but we do have powers under our Public Health Act that if anyone is not complying and posing a risk to the community, we can do things called Section 62s, and police assist us by then supervising the arrangements around the security of those individuals. In assessing whether we have lockdowns, we look at whether there is a risk to the broader community. Have we effectively identified all the cases and the contacts? And if in doubt, at the moment, particularly where there's low vaccination coverage, particularly vulnerable communities, we take a precautionary role. And that's, I think, what the community would expect us to do.
How is it that you're comfortable with having the friends bubble, but fully vaccinated adults can't go and visit elderly residents in aged care facilities, given the health impacts of extended isolation?
Look, I'll just take the question about aged care facilities visits and just say that I really recognise the importance of that social engagement for elderly people, and I appreciate how hard it has been for them to be isolated from their family and friends. We are working on having more rapid antigen testing and other controls, and we're also wanting to see the community levels of the disease go down. But we are working on some things to support safe visitation, particularly choosing, for instance, outdoor environments as the weather has got better. Obviously, the last thing we want to see is aged care outbreaks at this time. So we are taking a very cautious approach, but we do really recognise the impact it is having on families.
Just in terms of opening up at 70%, we've heard that you and your health team might advise if there are high cases in certain areas that you might keep more restrictions in those areas. Could that also apply to areas that have low rates of vaccination where we hit that 70% target?
Oh, look, I think the Premier's been very clear that when the 70% roadmap was announced, that it's very contingent on where we are at case numbers, which I would like to doubly incentivise the community for doing the right thing, continue to get tested, adhere health orders, because we need to see those case numbers really go down significantly over the coming weeks. As I said, the community has a choice at the moment. We need to see those cases get low, and we also need to see those vaccine coverage rates go high. I would like to urge there has been Moderna distributed in regional areas through pharmacies, and there also has been increased Pfizer supply through general practice that the Commonwealth has distributed. So I would like rural regional communities in particular to check with their local GP, because there now may be a changed circumstance. They may have checked 3 weeks ago and not been able to get a booking. So please redouble your efforts, get vaccinated. And I would also like all those 12 to 15-year-olds to get their Moderna or Pfizer as soon as possible, so we can get those 2 doses in before they return to school later in the year in October.
Obviously, we haven't seen, just in terms of the modelling that we haven't seen that peak reach 2,000 cases a day yet. Does that mean that you are hopeful that we won't reach the hospitalisation and ICU capacity as well? That was pretty, given the modelling kind of, yeah.
Look, I think it's important to say that we're seeing a variety of different effects coming to the whole. So we're seeing some pleasing declines in the local government areas of concern in general. There are still some local government areas that still the disease is continuing to bubble along at high levels. But we are seeing a turn in some of those local government areas. But we've also seen increases in Sydney. We've also, the Sydney Council area into our southeastern area, which is around Maroubra, Randwick, those areas. We're seeing Illawarra. We've also seen Newcastle have higher rates. So we're seeing, when we look at the case numbers, it reflects basically 2 different patterns. Decline here, declining in the local government areas of concern as a generalisation, and increase in other areas. And so it is important that we turn all of those outbreaks, which are driven by different factors in each area, and that's why we haven't taken the same approach as we've taken in the local government areas of concern, because the drivers for how those cases are being generated is different. And you've seen the great work that, for instance, Sydney Local Health District has taken on in our social housing and our homelessness in order to get vaccinating in boarding houses, our social housing, engaging with our drug and alcohol clients in order to close down that outbreak.
Sorry.
Fireworks, and I hear fireworks being cancelled. Is that disappointing given we're probably 9%?
Look, obviously it's months ahead of us thinking about that. Last year, the Sydney Council decided to do that, and we stepped in and did it. I would suspect that no matter what happens, what situation we're in, the fireworks are always a sign of hope for the new year, and the New South Wales government is considering our options.
Why are you allowing construction to return without a mandatory vaccine in place for everyone? Obviously, the LGO.
Well, obviously, there are strict rules in place for workers who go back to workplaces in relation to vaccination rates in construction sites, and that was based on the health advice at this time. Although I should say this, that we are keen to make sure that when it's safe to do something, that we allow that activity to continue, and it's in a broader sweep of arrangements we have in place. And we also have to appreciate how tough families and individuals have been doing it, and also think about what recovery looks like once we get to 70% double dose. So there's a whole range of factors we need to look at. It was, I know, an opportunity for me now to thank the construction sector, who were dealt a huge blow when we asked them to shut down and take a pause for 2 weeks. They've now resumed in a very COVID-safe way, and we need to make sure that stays that way. But that pause allowed the industry to put in their COVID safety plans, put in the vaccines, the vaccine strategy, put in other practices to keep the worksite safe. And we're now at a much more comfortable place, acknowledging that many workplaces have done enormous amounts of work to keep their workers safe and the worksite safe, and obviously very little public-facing interaction. And for those reasons, the government took that decision.
When restrictions ease at 70% double dose vaccination, there'll be a cap of 5,000 on major recreational facilities that are outdoors. There's no cap on indoor facilities. That means Kudos Bank Arena could have 13,650 people in it. The state in Australia, which is outdoors, only have 5,000. Why does the cap apply outdoors but not indoors? It doesn't really make much sense.
Well, look, there are obviously reasons that those measures are in place, but it's also important to note it depends very much on the type of event, and obviously ticketed seated events are the safest because you have control over, well, bad use of words, but you essentially can ensure that people are sticking to the rules, they're seated. There are certain events where that's the case. Obviously, as we get to the 70% and also between 70 and 80%, I envisage a lot of major events will be seeking exemptions from the government, but we'll have to address everything on a case-by-case approach and in a safe approach. And that's what we've done beforehand. Specific organisations have approached us to say, can we please have an exemption? The health experts give us that advice and then government makes decisions. We're not in the mood to do that ahead of us getting to the 70%. Given we don't know when the 70% date is, we don't want to give anybody unrealistic expectations, and therefore we're being very cautious and making sure we stick to the current plan until we at least get to the 70% double dose. Look, I know that everybody's itching to do that, but that brings with it a level of risk, and I suspect that could very well be something we consider at 80%. I mean, the 70% roadmap is already there. There are obviously opportunities for us to look at a number of other settings that weren't considered, but we need to do what's safe, and we're hoping that there isn't a lot of difference between 70% and 80% given the rate of how quickly people are getting vaccinated on the second dose. We'll take Dr. Chan's advice. The best advice I have is that's something that's more appropriate at 80%. And again, if it's only a couple of weeks, wouldn't everybody rather we keep each other safe for just a couple more weeks? There's so much all of us are itching to do. So much, you know, I can't wait to see members of my family. I'm sure everybody is really looking forward to something that they want to do. But we just have to do it in a safe and cautious way. We don't want the hospital system overwhelmed. And whilst it's easy for all of us here to be talking about all of this, we've got nurses and doctors and allied health supporters in our hospital system today working their guts out. We don't want to put any more pressure on them than we need to. And most importantly, we don't want people to end up in hospital. And that's why we do need to take a cautious approach. And I know it's frustrating and people need to wait, but I'd much rather wait a couple of weeks for some of these things than risk having the cases go through the roof, or I should say, and then having the number of people in intensive care go through the roof. So if it's only a couple of weeks, I just ask everybody for that patience. There'll be plenty for us to do at 70%, which will keep us busy. And then obviously in that time, schools will be going back. And then at 80%, there'll be a whole range of other things we can do as well.
Need to return a negative test to travel to the region at 70%, or is double vaccination going to be the rule?
Well, double vaccination is the rule, and as we said, we're hoping that everybody will be able to have that mobility across the state once we get to that level. That's why it's really hard for us, it's really important for us to try and reduce the viral load in particular communities so that when we open up, everybody will have that access. There's no doubt that we're keeping a keen eye on the vaccination rates in parts of rural and regional New South Wales. We don't want any vulnerable communities unnecessarily exposed. Similarly, we would like to have everybody have the same rules once we open up, but that depends on what the virus is doing at that time in particular communities. It could very well be that a country town might suddenly have a surge in cases, and we'll say to everybody, please don't go to this country town for the next week or 2 weeks because there's cases there and we're still managing that. Or it could very well be a suburb, or we might say to a local government area, please stick within your area if you want to go to a restaurant or get your hair cut or whatever else. So there's opportunities for us to do that. The Doherty plan, the national plan allows us to do that, especially between 70 and 80%, which is critical. So I do expect that there will be some circumstances between 70 and 80% where we do ask certain communities at a particular point in time to consider the health advice. So it's not going to be a perfect world from 70% double dose, but it will be a much, much better world. Until we get to that 80% double dose, we'll be relying on the health advice. So it could be a country town, it could be a suburb, it could be a region where we say to people, look, for the next couple of weeks, can you just limit your activity to your area because there's a high number of cases and we don't want that to spread. And that is what is part of the national plan and part of our roadmap. And obviously once we get to 80%, the incidence of that occurring will be far less. It's no different to when before Delta, if we had a restaurant with an outbreak or a school, we'd shut that down temporarily or ask people to take particular action. I think we're all used to now adjusting and being flexible. But the good news is if you're fully vaccinated, you will have access to a whole range of services, opportunities, freedoms, which you don't have today. And that's something all of us can look forward to no matter where we live.
Sorry, can I clarify your answer, Alex? community sports will be back at 80% covered those days?
Oh, look, we're seeking the health advice on that, and we'll let you know as soon as we get the health advice and government considers its options.
And just on the water bubble, there's some inland regional towns, like one called Jennings, where like the border is splitting them in the middle of this town. People can't go to their jobs, people can't see anyone. We always hear that you're negotiating with the Queensland government and the discussions are ongoing, but are they actually ongoing?
Well, they are. We have a cross-border commissioner in New South Wales who does an outstanding job on behalf of the government to make sure those discussions are ongoing at that level. And you know, these are always difficult circumstances, and we are always on the side of compassion and erring on the side of communities have lived together for decades. They know how to keep each other safe. So New South Wales's position is always about trusting communities to do the right thing, and I hope our Queensland counterparts have the same attitude.
Last one, please.
Just on school balls, Premier Brodie Taylor says that they should be back. Do you support school balls if we get to 80%?
I can foreshadow that this Year 12 cohort, more than any other, deserves to have a good end-of-year celebration. They will occur in a safe way, and the Education Minister will have more to say about that. But I want every person who's graduating, attaining the HSC, to know that there'll be significant celebrations to celebrate those important milestones, and the Education Minister will outline the time it's safe to do that. But I don't want anyone to be worried. Focus on your studies, do as best as you can in your exams, but please know that there will be an opportunity for you to celebrate what is an important milestone during a particularly stressful year. Thanks everybody, have a good day.